Hello everyone, it's Dr. Sam. I'd like to welcome you to my EyeClarity podcast. This is a show that offers cutting-edge information on how to improve your vision and overall wellness through holistic methods. I so appreciate you spending part of your day with me. If you have questions, you can send them to hello@drsamberne.com. Now, to the latest EyeClarity episode. Hey everybody, it's Dr. Sam, and I'd like to welcome you to another EyeClarity podcast. So today I want to share an interview with Margaret Romero. She actually interviewed me on Instagram Live recently, and Margaret, she's a really cool person. She was Columbia trained as a nurse practitioner. She's a functional medicine consultant specializing in things like lupus, thyroid, GI issues. She's got a podcast called the Sacred Medicine Podcast. So we have a nice discussion about some of the things I'm doing, especially in holistic vision care. So I hope you enjoy the show. Thanks for tuning in.
So I'm excited to talk about some of these eye issues. I see them constantly.
Oh, wow.
Constantly at the urgent care when I work there one day a week. So why don't you just give us a quick, snippet on who you are and what you do.
Okay, so my name is Dr. Sam Berne, and I'm a holistic optometrist. I've been in practice over 35 years, and I have a lot of great methods to help people improve their vision, especially as we get older. I work with infants, elders, everybody in between, and my belief is you don't have to live out your doctor's diagnosis, and you can improve your vision at any age.
I love it.
So we'll leave it at that.
Thank you so much for being here and sharing your wisdom with us today. So one of the things that I see so much of, and tell me why this is pink eye. Every week that I'm at the urgent care, people come in with pink eye. And I know, conventional medicine, it's just a bacterial infection. And you give tobramycin or whatever bacterial drops for it, and that's it. And I want to know why I see this so much more in the winter, and what can we do to prevent it? Is there something we can do that does not require antibacterial drops?
Sure. So pink eye, or better known as conjunctivitis, is super contagious, and especially with kids. You just rub your eye a little bit, and all of a sudden, if you've got a bacteria, and this is related to something which I call the ocular microbiome. So we have a microbiome in the body, but we also have an eye microbiome. And so when our eyes dry out,
I know that.
Yeah, I did an article in Mind Body Green about ocular microbiome, and I can send you the link. Anyway, so if you're a contact lens wearer, if you use eye drops that have a lot of preservatives and chemicals in them, or you've had eye surgeries that reduces your immune health in the eyes, if in Chinese medicine, the upper eyelid represents your spleen health, and the lower eyelid represents your stomach health. So that's more from an energetic point of view. So I like to go for herbs and compresses and natural eye drops as a way to, treat the cause. And so, for example, you could do compresses like burdock or golden seal or echinacea or eyebright. Those are great to do a few times a day if you're able to do that. Finding eye drops like homeopathic eye drops are really good. So Similasan, Optique by Boron, those are homeopathics that keep the eyes more hydrated. Similasan actually has a little eyebright in it. So that would be something to do, say, 4 times a day. My MSM eye drops work really well. That's a sulfur molecule, and that reduces inflammation. And also things like colloidal silver, if you can get a really good organic colloidal silver, that works really well at nipping pink eye in the bud, if you're open to that. And also organic castor oil, if you massage a little bit on the eyelids, that's a great anti-inflammatory agent. And a little commercial here, I just created a certified organic castor oil eye drop, and it's great as a lubricator, moisturizer, anti-inflammatory agent. And for people out there that use makeup, a lot of times they have to check what's in their makeup. Skin Deep is a website we use to analyze, what's actually in eye makeup. That can be an issue. If you're a contact lens wearer, and, being on the computer all day, eye stress, the blue light dries your eyes out. And the thing is that with pink eye, there's some low level of inflammation going on. And so again, there could be systemic and metabolic and endocrine reasons why that it starts to affect the eyes. And there are functional reasons, how you use your eyes together. Are you focusing well? This is why eye exercises that I recommend can also help. So there's a functional perspective in this as well. And the bad news is when you use antibiotics, it reduces your ocular microbiome. It treats the symptoms for a little bit, but usually it doesn't get rid of the cause. And that's the conundrum that people get into when it's a staph infection and they start taking a lot of antibiotics. I would definitely do some secondary things to boost your immune system and including your ocular microbiome with natural eye drops and things like that.
So the eye drops that you just mentioned, like the Eye Bright, for example, can that help restore the eye microbiome?
Sure.
If someone's been on tobramycin, often.
Yes, exactly. You can use those pharmaceuticals, initially for a few days to help with the symptoms, but you got to take it further than that. If you're on tobramycin for anything longer than a week, it really does. It affects the pH in the eyes and it reduces the ocular microbiome. That's where the homeopathic eye drops are really important. And then doing something in the evening like a castor oil eye drop or doing some of these compresses, Golden Seal or Eye Bright or Echinacea as eye compresses are wonderful as a way to restore the ocular microbiome and reduce inflammation. And when you do that, then a lot of times the bug goes away. And during the period, you have to be careful from a contagious standpoint. Don't share washcloths or towels, or I'm sure you counsel people on that. But unfortunately, the pharmaceutical world is symptom-based, and it drives the cause further in. So it doesn't. Totally. It's not really the answer.
Yes, I wholeheartedly agree. So with something like Golden Seal, when you say compresses, are you saying like open up the capsule in warm water and then?
Yeah, so you could either, so you could either do a capsule form, or if you have an herbalist, or you can get, some tea, either way. But yes, it's a warm compress, and you place it over the eyes. It's very soothing, Red raspberry leaf is another one. So whatever you can get in your local herbal store, Eye Bright's pretty available. You can even drink the Eye Bright as a tea, and also you can use it as a compress. That's wonderful for pink eye. And, if it's still not going away, I would look into getting some kind of an organic colloidal silver formula, and then you can use that as a compress as well. So there are a lot of different directions you can go. Pick your favorite herb. Chamomile is another nice one. You could just do chamomile tea bags over the eyes.
Over the eye. Okay.
Yeah. So
that sounds great.
So okay.
Now is all of this styes?
Okay.
Same thing. Like, is that like inflammatory process? Does the upper and lower lid also, did you say the upper lid is spleen and the lower is stomach?
Correct. Right. So you can get some acupuncture, and a lot of times that will redistribute the congested energy in the eyes. But a stye is a little different because usually that's on the eyelid. And if our eyelashes, get clogged up because they're meibomian glands there. Those are the glands that produce the oily part of the tears. So then that can lead to things like meibomian gland dysfunction and dry eye. So that's more of a condition where it's affecting the outer part of the eye. And then if it's away from the eyelashes and you start to get bumps, that's called a chalazion. And so that's like a lumpy, congested formula, condition. But it's similar. There could be some bacterial and viral and sometimes even allergic reactions. That's another one, or the makeup, contact lenses. Those are all issues that can cause the meibomian glands to get irritated. And, again, finding ways to reduce the inflammation. I find the castor oil is really good for meibomian gland dysfunction. And you can either put it in the eyes or massage it on the eyelids. MSM eye drops, Similacin eye drops. So I try to get people away from what's in the regular pharmacies, because those eye drops have a lot of preservatives. They have a lot of chemicals in them. And we're back to the ocular microbiome again. But it's similar. You use the same kind of compresses. And, so it's a similar situation as the pink eye, but it's more external. And it's more on the eyelashes, or the pink eye is more internal. It's more on the inside part of the eyelids. But, if you've got conditions like autoimmune, rosacea is an issue. I see a lot of ocular rosacea, uveitis, those conditions, where there's an autoimmune situation, you know what to do there. You talk to people about improving that part. The gut health and the eye health are very related in what I have seen.
That's not surprising.
Yeah. So those two are pretty similar in how you would treat it.
Okay. And so basically, there are some people who get styes often. They get them several times a year, and there are people that don't get it at all. Mm-hmm. Would you say that the reason being mostly is either low-level inflammation, gut issues, microbiome issues?
Yes, I would say those things, and I would probably add things like visual stress, if they're contact lens wear, what's their eye makeup like, those kinds of things. What is their eye history? If they had eye surgeries, have they taken a lot of pharmaceuticals in the eyes? Those are all secondary factors that reduce the resistance in the eyes, because we need the good bacteria and the healthy pH. If we don't have that, and there's dryness and inflammation, then it's a petri dish for, viruses and bacteria to get into the eyes. We don't have the immune health in our eyes to reduce the causes of it. So, you have to be a detective there. I would ask them about their visual stress. Do you get eye strain? Do you get eye fatigue? How many hours a day are you on the screens? Those are factors that we're seeing more and more computer-related visual stress because of homeschooling, and then adults that are on their phone and screen 10, 12 hours a day. And, we could talk about the nutrients that are really important, like vitamin A. That's super important. But if people have a challenge with their liver and gallbladder, they're not producing enough bile and they're not storing it. Bile helps us absorb the fat-soluble vitamins like vitamin A, lutein, and zeaxanthin. And those are critical for our eye health and many other things. So supplementing with bile salts after a meal can be helpful. So I'm always asking about liver gallbladder health. That's a big one. And more people either have their gallbladder taken out, or they have toxicity issues in the liver. And in Chinese medicine, the liver rules the eyes. So that's another factor. But vitamin A, lutein, zeaxanthin, hydrating your eyes, getting enough healthy fats and oils, especially omega-3s. And, there are other things as well, but those are the main ones. If people are under some eye stress and they're getting chronic styes or conjunctivitis, I would put them on a comprehensive eye vitamin for a few months and, really check in with their diet. around
Yeah.
getting enough antioxidants and stuff.
Sure.
Because the nutrients, the eyes have one of the highest metabolic needs in the body, and the retina especially. And right now we're discovering red light therapy. If you look through red light 3 minutes in the morning, that has been shown to regenerate certain eye conditions.
Oh.
So it's at 670 nanometers. This was a study published in the UK, University College of London. The Dr. Jeffrey's team did a study on red light and people over 40. And 3 minutes in the morning, they did it over 12 weeks, once a week. And they found they had a 22% improvement in visual acuity.
You're kidding.
Just doing the red light.
Wow.
So non-invasive. So the red light is addressing the mitochondria in the retina and ATP. So the ATP goes up, the ROS, the reactive oxygen species, goes down because that gets higher when your eyes are aging and you're getting more inflammation and oxidative stress. It also works great for drusen. Anybody out there who's been to their eye doctor and those cholesterol vessels that are growing in the retina, the red light has been shown to shrink the drusen as well. And, you might read the study and make your own determination, but there's so many great things out there that are helping us, and we need to get away from just treating the symptoms. And I know you're doing that too, so it's exciting to see others.
3 minutes once a week, and that's it?
Well, that's what the study showed. Now, it has to be in the morning. My protocol is I have people do it 3 days a week. And it's about 3 minutes. You want to do it in the morning, at least 3 hours after, no more than 3 hours after you've waken up. But the great thing about it is that this red light seems to be affecting the mitochondria health and the ATP health. So that's... Yeah, but it's pretty phenomenal to have that kind of an improvement in a study. And what they found is that between 40 and 70, those age ranges, they actually got more benefits than the people under 40 years old, which was kind of fascinating. And I didn't quite get that, but that's what they found in their study. So
got it. Okay, that's a really cool study. I'm happy that they did that with the red light.
Yes.
I feel like red light therapy is becoming more and more popular, I think, which is a
great
thing.
It is. Very, and accessible too. People can figure it out, how to get that kind of red light in their eyes. I'm putting out a new pair of glasses that's going to be red light. So it's just a pair of glasses that you wear that will have that red in it.
Oh,
and
very cool.
because I want to make it available to people so that'll be coming out soon.
So let's talk a little bit about floaters.
Yes. Okay.
I know that it can start as early as and correct me if I'm wrong, but I read this somewhere that it can start as early as in your 20s or even, I don't know if any sooner.
Yeah.
People get these floaters, and I always thought that it was something that people that were older got, but that is not true.
Well, age-related is certainly one factor, but also if you're nearsighted, if you've had cataract surgery or another kind of surgery called vitrectomies, which are used to reduce eye pressure, LASIK surgery, laser surgery can also trigger floaters. Even certain medications, non-inflammatory steroids, NAISD, like ibuprofen, those kinds of things can trigger floaters. So the big, yes. And so the big thing here is that the vitreous is the gel sac that sits in front of the retina, and it's made up of mostly water and collagen, proteins. And as we age, it tends to shrink a little bit. So if you're in a situation eye-wise where you're dehydrating the eyes, then what happens is the vitreous starts to pull away from the retina, and that's called a posterior vitreous detachment. And a high percentage of people will get that. Over 50, 60% of people over the age of 60 will have that PVD. And some other reasons why you might get the PVD or vitreous floaters could be, again, too much screen time, exposure to blue light, and just a general low-grade inflammation. Also could be heavy metal toxicities, Liver issues can also create the floaters. But the good news from my perspective is there are things you can do to, at the very least, neutralize the floater. So I'll go through my list. One of the top ones, and this was a study that was done, people that ate pineapple, the bromelain in it reduced floaters. So you could either take a bromelain supplement, or you could have your daily dose of pineapple. Another thing that you could do is make sure you up your vitamin C. So looking to get maybe 2,000 milligrams a day of a good vitamin C. Hyaluronic acid is another. It's a large molecule that helps kind of with the collagen levels of the collagen health of the vitreous. There's an eye drop called Hylatears, and it's from a company called Hyalogic, and that has hyaluronic acid in it. It's made for the eyes. MSM eye drops also work well, so you can do either a lower or a higher percentage of MSM, and that's helpful. You can do some kind of a liver cleanse. That can also be helpful. And another interesting connection is the lymphatic health. So if we're sitting a lot, if we've got a sluggish lymph system and we start activating our lymphatic health, and we do certain eye exercises where we're moving the eyes, this helps also get rid of the floaters. So lymph health and reducing floaters kind of go together. And, if you're scheduled for something like cataract surgery, there's a little bit of higher risk that you might get some floaters after the surgery. Diabetes, eye trauma, so concussions or, car accidents, food allergies, yeast infections. These are all things. And then from a Chinese medicine model, what we've learned is it's kidney congestion. So if you get some acupuncture and you get more qi into your kidneys, that can also be helpful. And so those are some of the main things. They can be frustrating, and I counsel people to be patient, because they may do something like hyaluronic acid or MSM, and it gets rid of some of them, but then they need to do a liver cleanse, or they need to protect their from the blue light, blue blockers. So there's a lot of detective work again that needs to be done about eye floaters. You don't want to do any kind of surgery or laser with the floaters. I've had too many car accidents with that, where people have had those laser surgeries and then it's creating a cloud or more blurred vision.
Oh my goodness.
So you don't want to do that. I think the red light is also helpful. So you bring back the red light therapy would be something I would do. And again, visual stress, what kind of prescription are you wearing? Do you wear progressive bifocals? Maybe you need to wear single vision lens for your screen time so you have more peripheral vision. And so those are the main things. I'll add one more, poor dentistry. So if you've had a lot of mercury amalgams or got TMJ or root canals, these are things that can, again, because it's right near where the eye is, seek out a biological dentist and get better teeth, dental health from a more holistic perspective. Yeah, I'm sure you do that
For sure,
too.
that totally makes sense.
Yeah.
So can floaters, doing a lot of these things, have you seen people really get rid of the majority, if not all of them?
Sure, of course. Yeah, okay. I mean, if you go on my website, my web store, look at MSM, I'm not allowed to write these things because of the FDA, but people will write in and say, I've been using these MSM drops and within 3 days, my floaters are gone.
Wow.
And so, I've had a lot of success stories with it. And for others, it's just been a slow improvement. And for others, they get better and then they come back a little. And so there's a stress component in it, adrenals, thyroid. But definitely, adding all of these things and more nutrients to your eyes, better antioxidants, you have a good chance of neutralizing and in some cases reversing the floaters. Yeah, absolutely. And improving vitreous health.
So good to know.
Yeah, it's definitely true.
Is taking oral, not antibiotics, taking oral probiotics, can that help with the eye microbiome?
I would say a little bit indirectly. The school is out on how much oral probiotics work. Are you doing fermented foods? There's lots of conversation about where we get our probiotics and
Sure.
so on. But I would say that here's a statistic. The eyes and the brain make up 2% of the body weight and use 25% of the food intake. So 25% of what we eat is going into this area. So whatever you're doing to reduce inflammation, improve dietary absorption, it is going to have an impact on your eyes. I mean, I read this statistic that the retina has the highest energy and metabolic need in the body because of the concentration of blood vessels. And it makes sense to me because we can look in the eyes and we can see early stages of hypertension, diabetes, and so on, all these conditions. So I would say that, whatever you're going to do to improve your digestive health, your GI health, I know you do this a lot. Yes, I think it can clear up your eyes. Doing a liver cleanse could clear up your eyes. Taking a break from screen time can clear up your eyes. So there's a lot of connection and collaboration between your gut health and your eye health.
I love that. I mean, you gave us so much today, because really the only thing we ever do for pink eye and size is antibacterial, medication. So I love all of these recommendations and using some castor oil. And the castor oil, you said that you can put it inside the eye, but you can also massage it on the lids as well.
Definitely. That's a great thing to do before bed, to just take a little bit of castor oil and very lightly just massage it over the eyes. It will penetrate and absorb during the night. And people that have excruciating dry eye in the morning, when they do that castor oil massage before bed, it is really moisturizing and hydrating. And then you've got your Similicin or MSM or Optique eye drops by your nightstand. Put a couple of those in. You just have to feed your eyes more hydration until you get to a loading dose where the eyes then revert back to producing enough tears and they're not evaporating and there's not that inflammation or infection that's affecting the tear production. But absolutely, the castor oil massage it feels good and it works. So I highly recommend it. Yeah.
So someone just asked, can someone use red light therapy with or without glasses?
You can do it without glasses. I would actually recommend without glasses. You don't have to see anything. It's basically you want to receive the red into the eyes. So you sit in a chair. You don't need a bright light source either. So you don't have to look into the sun or a bright light, just a mellow light. That was what showed in the study. They didn't use a bright red light. It was more dim. And you know that it's too bright if you start squinting or straining, then you're either too close to the light source or it's too bright. So follow that response if you're getting that kind of reaction. But do it without contacts and glasses, so there's more of a chance for the red to come into the eyes. This is where we want to receive the food this way, coming in. So we don't need to see clearly or need lenses. So take them off and just use the red lens during the treatment.
Is there a red light therapy company that you like or that you personally use? Or that you
there's a full body light panel, and I have no business relationship with this company. It's called Red Rush 360. And I like this company because it's a red light box and also near infrared. And that's also very helpful for your body and your eyes. And so the other thing is it's low EMF. And with that light box, it's pretty bright. So again, you want to be maybe 2 feet away if you're going to be keeping your eyes open. I start with the eyes closed because the eyelids are like window shades, so some of the light is still going to get in, but you're not going to have that brightness. Right. But red light on the body is great for inflammation, immune health, cardiovascular health, and many other things. I mean, you can look at the literature. So that's a whole body light box that works well, that people have responded to, and it runs somewhere $600 to $700. So that would be, an option if you want to get the whole body into the red light.
Okay. I do have a question here. Someone that's had MS has blurry vision. Any recommendations?
Well, one thing is, on my YouTube channel, I did a very extensive video blog on the relationship between MS and vision. And so you might check that out. But just simply stating, there are some things that you can do, and it's related to, and I don't want to get too into this, the relationship to your vitamin D levels and MS. And there have been some studies that show that if you do high dosages of vitamin D, that you can actually start reducing some of the MS symptoms and things like that. On an eye level, color therapy, light therapy is very helpful. Eye exercises are also really good. And the first thing to do is get an assessment of the optic nerve, because many times MS affects the optic nerve, which is related to how well our peripheral vision is. So getting a baseline of that, and then you can do either some, nutrient support, things like taurine and ginkgo and omega-3. Those are great for the optic nerve. And then some eye exercises can be helpful. But check out this video blog I did. I think it's about 10 minutes long. So I really dove deeply into, the biochemical aspects of MS and how it relates to the eyes and the body.
Very cool. And then for our last question, can these recommendations help an 80-year-old woman, or 80-year-old, sorry, it doesn't say woman, with diabetes? Oh, it does, in her eyes. So 80-year-old woman with diabetes. Can this help?
I would say that anything that you can do to calm down the retina circulation is helpful. So the red light therapy would be a place I might start. And also taking a look at some very simple, gentle eye exercises could also help. On the diabetic level, again, you can do some things like bilberry. That's wonderful for retina circulation. The carotenoids lutein, zeaxanthin, and astaxanthin, they're great for retina health and retina circulation. Those are gentle, antioxidants and carotenoids that if somebody has diabetic retinopathy, they want to be feeding their retina with these kinds of antioxidants, and they'll slowly start improving their vision and support their retina circulation better. That's a no-brainer. So I think there's a lot of upside for anybody at any age that's got diabetic retinopathy.
Amazing. Well, thank you so much, Dr. Sam. Everyone who's listening today, if you want to follow him, he is an amazing resource for eye health. It sounds like you also have a YouTube channel, and you're always on Instagram, so I see a lot of your posts and your reels and all of that, which is amazing. So
thank you for having me, and I wish you the very best, and we'll speak to you again sometime in the future.
Sounds good. I'll have you back for other eye topics. That'd be great.
All right, really good. Well, that was a great interview. I really enjoyed being with Margaret. You can check out her Instagram at Margaret Romero. She's got some excellent content on functional medicine, GI health, and many other things. So if you want to text me your questions, you can do so at 844-932-1291. That's 1-844-932-1291. Or you can always email your questions to me, hello@drsamberne.com. So that's our show for today. I want to thank you so much for tuning in. Until next time, take care. Thank you for listening. I hope you learned something from the EyeClarity podcast show today. If you enjoyed the episode, make sure to subscribe on iTunes or Spotify and leave a review. See you here next time.